Hi everyone, my name is Rich Broski. I'm the Communications Director at the Center for Hope Hospice and Palliative Care. I wanted to make this video basically to let you know how we're doing. The center's had to make some pretty tough decisions over the course of the pandemic. However, we've never closed our doors to anyone who's needed us. We've been open to evaluations, new admissions, and maintained our high standard of care as best we could. We've also been incredibly fortunate in that every measure we've had to take in regards to the safety of our patient, families, and staff has thus far worked. So, as the state starts to reopen at the time of this recording, it's June 23rd, 2020, I wanted to check in with our frontline staff, our own heroes of healthcare. Please note that everyone I spoke with talked to me via video chat on their cell phone, so the video may be a bit bouncy at times. Anyway, I first talked with our president, Mr. Frank Brady, to see how things have changed and how things went.
I have to say that the pandemic has changed the way that we work for not only myself, but all of administration and all of our clinical staff. My heart goes out and my big thanks go out to our clinical staff, even our housekeeping, our maintenance personnel, kitchen personnel. They're all helping to keep our patients in our specialized residences safe and well cared for, and also trying to keep themselves safe.
John is one of our aides. He visits patients in the field or in other healthcare facilities. He was in his car when we finally caught up with him.
Has it been scary going into people's homes?
Yes. And even when you go to like the facilities, I'm not working there, but just being there, it's scary because, you know, you're in the atmosphere of the environment where you have the COVID lurking around. So, you know, it's really scary. The only time I feel really adjusted is if I'm by myself.
I was asked to admit my first COVID patient in the field. And this is a man that we knew had it. And I mean, I'm gowned and I'm gloved and I've got goggles and masks and everything on. And it was a little frightening still. But again, I have his wife saying, I don't know what I'm going to do. We've been together 60 years. How can I live without him? And once again, that changed my heart and my soul back to my whole mission of who I am, is I'm there to help. And sure, I take care of myself, but I can honestly tell you that I walk in on patients that are positive and I don't have any fear anymore. And it's just amazing because you turn back into a nurse when someone gives you the opportunity to, I guess.
That was Donna. She's an RN who visits center patients who primarily reside in other care facilities. I also spoke with Allison, who's been a nurse with the center for many years, and over the course of the pandemic, she served in many different capacities.
As a nurse, registered nurse, and I've been shift supervisor, I've been staff, I've been the runner, any of those things, however the need is presented, I do it.
She's well versed in the center's actions in regards to the pandemic.
Well, when I'm here in Scotch Plains, and if I've been on the wing that we have dedicated to new incoming patients, either COVID positive or COVID negative, we wear extra protective equipment, we have extra doors closed. Throughout both facilities, we're very alert to hand washing, wearing masks, wearing gloves. All of that is normal for all of us, but having that extra protection on that wing, I'm very happy to say, and I'm only one of many, many staff that have been in there, that we have had no new infections, no spread of infections. We have been really very safe. And being that safe and everyone being consistent, it's not as scary as some people might think.
Rosemary is the center's community hospice coordinator, and she offered her perspective.
When this pandemic started, we had a lot of support from senior management as far as what the requirements were for the COVID-19. We've provided our staff with the correct and appropriate PPE, which is personal protective equipment, gowns, masks, gloves, goggles, shoe covers. We went above and beyond to make sure they were safe and our patients were safe.
I think that Center for Hope, for the fact that Elizabeth, none of the patients, none of them fell ill with the COVID virus. I think what they did was honorable and smart, and it was just, they were practicing very safely.
That was Lisa, a nurse case manager in our facilities. Talking with her and everyone else, I learned that even in the midst of a global pandemic, the touching moments we usually experience in hospice can still happen.
We were able to hold a wedding on site here, and even with the restrictions on visitation, the brides were able to go to the window and the patient was able to see his daughter getting married. And there were other family keeping socially distanced who were able to be out on one of our patios that were set up for the wedding. We had volunteers come in to decorate with flowers and streamers and all. And it wound up being a beautiful affair and something that hopefully will be a good memory despite the sadness of the father having been a patient here.
It was a touching moment for me to have this wife who could not come in and say goodbye to her husband. And we've been using FaceTiming, we've been using the telephone, and we've been explaining things in greater detail to families that cannot be bedside. So we've had to be the eyes and the ears and the loving arms to reach out and play a family member as people are declining and dying.
Mary is another one of our nurses who, when we finally had a chance to catch up, was working in the COVID wing.
It's a lot. It's so important. I've been working on the COVID wing, so just keeping some of the PPE on while I'm talking to you now. Can you hear me okay?
Yeah, I hear you fine.
It's an area set up to isolate patients with the disease or patients suspected to have come in contact with it. Behind her mask, she shared how her patients are feeling.
I have a patient that's on oxygen, and it's difficult to communicate. And he took a while to really get my attention, wanted to make sure I clearly heard what he was saying. And he looked into my eyes and he said, "You are so kind."
That must be difficult too, because were you all, geared up in the whole 9 yards?
All geared up. But they feel it through these physical barriers that we have to have. The genuine care, love, even love.
Lisa had sent me this picture before our interview, along with an explanation about how it gets difficult sometimes.
You can still get the touch in. We are still bedside. I'm afraid people with dementia are really confused, like they are in a Star Wars movie, but we are still reaching them and we're still able to nurture them bedside.
Well, there's still so much that we don't know about this virus. What has served us so tremendously well is the caution we've been taking. So we're not about to suddenly fling the doors wide open. But this is an ongoing discussion because the staff sees the heartbreak of families only being able to visit in the window. And in Elizabeth, they can't even do that because the patients are up on the second floor. We want that interaction between the family members and the patients that are here. But we also don't want to relax anything too quickly. I think it's going to be very, very thoughtful, incremental, cautious, step by step in seeing what works and how we can maintain the protection that our patients need, and for our staff as well.
Donna agrees that it's also been extra difficult on our patients' families.
Whatever you're feeling, it's okay to feel that. I know that you were already so impacted by your loved one passing away, and now it's making it worse because you're not able to see them. So whatever you need to ask me, whatever you need to tell me, the one man I was telling you about, the one from this morning, today when he was standing outside his wife's window, he was blowing her kisses. So I pretended to catch one in the air and put it on her cheek. It's like whatever you need to do to try your best to connect with your loved one, it's okay if there's anything I can do to help you with, because all I can say is, as much as I was already empathetic for your plight, I'm even more so now because of the situation that we're all in together.
John brought up an interesting topic. Our patients' families aren't the only ones with reservations.
Well, my family, for that, they would not want me to go to work. They would not want me to go out there because the fear of coming back home, and they don't know if I'm coming back home with something.
A theme I kept hearing is that for our frontline staff, yes, COVID was a concern, but everyone shared a common mission: provide our patients with the same level of extraordinary care that the center's known for.
Our Center for Hope philosophy is that we immediately respond to our patients' needs out in the community and in the facility. And when the pandemic happened, we continued that 24 hours a day. And I must say, myself and all of our nurses here went above and beyond. We're so used to providing 100% attention and care that when the pandemic happened, this is what we know what to do and this is what we did.
No, there's a genuine, people are jumping in. The COVID, we're not afraid of COVID. We're more concerned for the patients and their safety and their care. Our PPE for standard precautions are strict and adhered to, but we're not afraid for ourselves. The care and concern for our patients outweighs any concern for ourselves.
We're a healthcare facility in the midst of a health crisis. Thankfully, our entire staff is used to dealing with health crises every single day. And even in the midst of a global pandemic, everyone agrees that our staff has risen to the occasion.
I would just like to tell my coworkers that you've done a fabulous job. I am so proud of each and every one of them stepping up to the plate, following our directions, continuing to give the best care that they have been giving before this pandemic. And it's just so nice to see everybody working here as a team.
Everybody's pulling together, everybody's working together, covering each other. It's beautiful. It's really nice to have colleagues like this that all think the same way and love patients the same way. The aides are wonderful, all of the staff. It's just where I want to be, and I'm very proud to be here.
I want to thank all of them for the amazing, intuitive work they're all doing. This is nothing like any of us have ever seen for 100 years. And for the 12 years that I've done hospice, there have been a lot of intuitive moments that you have to react quickly and honorably to. And the staff has been tremendous. I'm really very proud to be working with this group.
I respect every one of you. And every time I see one of you, I try to smile behind my mask because I know how much the solidarity is appreciated. You know, just talk to each other. Talk to me if you need to. Let me talk to you. Just let me say I'm having a bad day. You know, give those virtual hugs and just know that the best you can do is the best you can do. And that's got to be enough, because whatever God gives us to deal with this, we've got it right inside of us. And I'm here right beside you. And, you know, your mask is part of your armor, but you shine through that armor.
Congratulations. Thank you. You're doing an awesome job. We're working as a team. We're all in this together. We're keeping each other and our patients safe. And as time goes on, and as some of the restrictions are very cautiously lifted, I'm sure that we're going to still continue to give excellent care to our patients and welcome their family members just as soon as we can.
Frank Brady, the center's president, sums it up best, with a genuine appreciation for our staff and the community of which we're a part of.
To our nurses and our nurses' aides, I need to give not only my heartfelt thanks, but also the recognition and the appreciation for how you've risen up through the challenge. Especially in early days, we were following changing information on a day-to-day basis, but you stuck through it. You learned how to do things in new ways. You've kept yourselves and our patients safe and still held up our high standards of care. The one other thing I would like to leave you with is a big thanks to all the families, our patients, our supporters in the community who have continued to find ways to work with us through unusual times and sometimes restrictive ways of working, and also continue to support us by even donations. People making masks for our family members at home and our staff. Everything that people could think to do to provide support to people in need, people in the community have stepped up to do. And that is also an amazing experience here. And it makes us here very proud to know that we've earned the respect and the support of the community that we serve. So thank you, everyone.